week is our lab test. It always takes us 1 hour, always, to set up lab tests, so you'll come at noon. There'll be 25 stations, 1 minute per station. You're always welcome to touch things, wear gloves. So overall, including your walking, a half hour-ish, and you'll be out of here. And we also will post the answers out in the hall so that you can have instant feedback. And if you don't know this, I post your lab scores on Blackboard because I can't on your other website. And do you know that next week is also your online exam? And those open Thursday, like at a minute after midnight, and close at Saturday, like a minute before midnight.
So what is your, ideal way that you would say people should really make sure they know the stuff for the online test?
Yeah, so for the online test, assumingly you're doing the homeworks, right, those flashcards, then I would go to my website, the thing with the turtle on it is my website, and I would look at the learning objectives for exam 1. And if you don't know this, on my homepage, on the bottom of my homepage is a link to the answers to my objectives, and I would go through those once before the exam.
Okay.
So that was a good question. Good answer too, huh? What else? So 3 labs on your exam next week in lab, right? Endocrine. If it's not on your lab objectives, you don't have to know it, right? Endocrine, blood, remember we did blood last week? And then heart from this week. If you can follow what I'm gonna show you on the heart, I think you will find the heart to be easy peasy, okay? That's an anatomy word. So back on the blood and the endocrine, I have practice questions on endocrine here on the mink. Do you see them out right there? So there's some practice questions from endocrine on the mink. Plus, Dawn is going to stay stationed at the mink and show you the 3 heart things that you have to know on the mink so that you don't have to get out your whole mink just to see 3 quick things. So he'll demo the 3 heart things on the mink. And then we have some practice questions in the back, endocrine histology, and blood questions on the back. So do the practice questions. I think my TAs are often using the same things on the real test that we asked on the practice test. Questions about what's coming up? So heart, I'm going to show you an easy way to learn the heart. All of these hearts are from sheep, but they're roughly about the same size as our heart. And they're all cut in a frontal section. Do you know frontal section? It would be cut like this. And so they all are going to open like this. They're going to stay attached on one end so you have both sides. And if this were my heart, they all open like that. If you can get oriented on the heart just by looking at it, this is easy. So what I want you to do is first get the hearts. They're all in the buckets over there. And we have tons of hearts. You can have 1 heart for every 2 people. And the first thing I want you to do is to get oriented. Superior from inferior, left from right. And I'm going to show you how to do it. While the real heart doesn't have the bump here, and I did it so you knew it was a heart, yeah? But it does have the point, the apex, the point at the bottom. So you should be able to orient superior from inferior. And then the outer wall on the left side is really thick. So this is left, this is right, correct? I'm facing you. This is my left hand, this is my right hand. You're gonna open up the hearts, and there's some hollowed out chambers. There's 4 hollowed out chambers. That's where the blood would be if you were alive. We're gonna look at the outer wall of those chambers. This one here is skinny, this one's fat. Fat, that is always left. It should be like night and day difference that you can tell left from right. And I'm gonna assign my TAs to come around to every single table and have them show the TAs which is left and which is right. If you can get oriented on it, again, this is easy. So thick outer wall, always, left, always. And again, it's not a subtle, oh, maybe I can see it or maybe I can't. It should be so obvious. Next thing you're gonna do is look for what we call AV valves. And the AV valves stand for atrium and ventricle, and they have these strings coming from them. The reason you have valves is to keep blood going from here to here and not backwards, because then you'd have to pump the blood twice. Once you see the valves, you can now name the 4 chambers. I know this is the left side of my heart, yes? Above the valve is my left atrium. In this case only, you do have to know left from right. I would never ask you, is it a left testicle or a right testicle, right? But left atrium from right atrium, very important. So the only thing, and we'll say this again next week, you have to know left and right on is the heart chambers. So the hollowed out part above the valve, left atrium. Below the valve is left ventricle. So then the valve is called the left AV valve. That's pretty easy, yeah? And maybe you've always learned this as the bicuspid, or maybe you've called it the mitral valve, but I would say to you, based on experience grading these tests, you're safest to call it the left AV valve. Because if it's the left AV valve and you get mixed up and call it the tricuspid, I'm gonna count it wrong.
Is it okay to actually say AV on the exam instead of
Fine with me.
ventricle?
Because we all know A is atrium and V is ventricle.
So you'd be fine for us listing as bicuspid, tricuspid, though? That would be correct.
As long as you call this one the bicuspid. If you call this one the tricuspid, I'm gonna count it wrong, because it's not. So that's fine. I'm just saying this is safer based on my experience. How do you know it's the left side? It's got the fat wall. Okay? Above the valve with the stringy things on it, you can't miss it, is atrium, below is ventricle. Therefore, this should be easy. So skinny side, above the valve, right atrium. Below the valve with the strings on it, right ventricle. Why is the valve there? To keep blood going from atrium to ventricle and not backwards. So this, then, I would call the right AV valve. You can also call it the tricuspid valve. But if you call it the bicuspid valve, I'm going to count it wrong. That's why it's kind of safer to go with this one, because you won't screw up, yeah? Okay. If you can identify the 4 chambers on any heart quickly, easily, by sight, this lab will be a piece of cake. Because then you need to find the blood vessels going in and out of these chambers, and I don't want you to find the blood vessels by looking at the picture and trying to hold the heart so that the fat is near the left and next to the red thing. You'll be so lost. If you learn the blood vessels according to which chamber are they going in and out of, this will be easy. And we will have them probed for you next week so that you can see, if we ask the blood vessels, which chamber they're going in and out of. So today you should be using a probe to poke around. The blood vessels mostly went with the sheet. All you're gonna have is a tiny little stub of a blood vessel, but nonetheless you have to know what it is. Here's how you're gonna do it. So there's 2 blood vessels that when you use your blunt probe, don't make holes, use the blunt probe. 2 will probe into the right atrium, right? And you already know what a right atrium looks like, yeah? Then you're gonna go home and memorize the 2 that go into right atrium are superior vena cava and inferior vena cava. You won't know which is which unless you find both of them and see which probe's on top and which probe's on bottom. If you have trouble finding it, cheat and do it backwards. Go into the right atrium and see where you come out. That's why you shouldn't use a sharp probe, because you might make a hole, right? So this is easy if you can do the 4 chambers. Then we have one going to the right ventricle. It actually comes out of the right ventricle, and it's called the pulmonary trunk. And by definition, all trunks are arteries. If you called it a pulmonary artery, I'm fine with that. The reason it's called a pulmonary trunk is it's going to the lungs, and it comes out like a tree trunk and then goes to right lung and left lung. So that's where they got the term trunk. But all trunks are arteries, so if you called it the pulmonary artery, I'm fine with that. Pulmonary means lungs. How are you gonna know it's a pulmonary trunk in lab? Not by what it looks like. You're gonna stick a probe in it. If you end up in the right ventricle, you're in the pulmonary trunk. That's why if you can do the 4 chambers and then you memorize this, it's easy peasy. There will be a little half-moon valve on the way to the pulmonary trunk, and he's called the pulmonary semilunar valve. So I don't know where I can write it. I'll write it over here. Why do you suppose it's there? Right. So if I can pump blood from my right ventricle into the pulmonary trunk, it's not going to go backwards. And it doesn't have the strings like these valves. It looks like a half moon. Isn't this easy? Yeah? Okay. Then you're going to have 1, 2, 3, maybe even 4, depending on how the sheep heart was cut, that's going to go into the left atrium. Okay? If you probe it and it goes into the left atrium, it's a pulmonary vein. How are you gonna know? You stick your probe in it and you end up in the left atrium. Yeah? And then lastly, one more is coming out of the left ventricle. And it's called the aorta, which is an artery. And he also has a semilunar valve. Can you guess what its name might be? It's called the aortic. Why is it there? Prevents blood from going backwards. So if you can site identify on the hearts, the 4 chambers, then you're going to just memorize what goes in and out. There's a few other structures you have to find, but this is the majority of what you have to find. And then just a handful of other structures. I think if you can get oriented, this will be an easy lab and you'll be out of here in no time.
I just want to say on the on the test next week, the arteries and the veins are already going to be probed. So it's already going to be probed going somewhere, and you're going to have to name that
Right.
artery or vein or whatever it is.
Right, but we're not going to tell you it's going into the left
Right.
atrium. You'll have to site identify. And I just remembered they have to look at cardiac muscle under the scope today. So while you guys get started, we'll set out a practice cardiac muscle scope. Any questions? We have tons of hearts. I happen to have pulled one out that I thought was gorgeous, so somebody can take it. And there's little trays. Isn't there a cupboard that says trays there? So there's little trays, so you don't have to use the big ones. You can use the big ones. And all of those buckets, except for the little bucket that says brains, all of the rest of those buckets are hearts. Questions? Go.
As quickly as this was sketched, I would take a picture of it. It's really a good picture.